Good evening. I am Dr. Satish Patil, a Chief Consultant Physician at BM Patil Hospital, Belgaum, with 18 years of clinical experience. So, in today's session, we will discuss pedal edema as an indicator of chronic kidney disease. So, let's see what is pedal edema, its causes, and how it can signify the presence of chronic kidney disease. Pedal edema is swelling of the feet and ankle due to fluid seepage into the tissues of the leg. Okay, it can be seen in many diseases like chronic kidney disease, liver disease, heart failure. Even certain medications can cause pedal edema. And often it is the first sign of the health problem. So normally the fluid from the blood vessels stays within the blood vessels. It doesn't leak into the tissues. But sometimes problems can happen, and then the fluids leak from the blood vessels into the tissues of the leg and feet, and the swelling or the pedal edema starts. What factors determine the swelling actually? So sometimes the small blood vessels in the legs become fragile and weak, and the fluid starts leaking through that as if it's a leaky pipe. Or when the blood pressure in the vessels increases, it forces more fluid from the vessels into the tissues, increasing the swelling. Or it can be decreased albumin in the blood. So when the albumin or the protein in the blood comes down, then the fluid doesn't remain within the blood vessels. It slowly leaks into the tissues from the blood vessels and further increases the swelling. The fourth factor could be a defect in the body drainage system, which we call it as a lymphatic system. So if this lymphatic system is defective, the fluid which has leaked into the tissues is not withdrawn back into the blood vessels. Hence, what happens? The fluid slowly goes on increasing in the dependent part of the body, and the swelling increases. So these factors together cause a noticeable swelling in the leg called as pedal edema. Pedal edema can be caused by a number of diseases, as we discussed, like chronic kidney disease, liver disease, heart failure, or even medications. In chronic kidney disease, the kidneys are unable to effectively filter the waste and excess fluid from the blood. And as the kidney functions declines, the fluid accumulates in the body and causing swelling in the legs or the extremities. So this swelling of legs can be an early sign of chronic kidney disease. So when we say a person has got chronic kidney disease, it means that the kidneys are damaged or they are not functioning well. And this process, if it continues for more than 3 months, then we call it as a chronic kidney disease. This condition means that the kidneys are gradually losing their ability to function properly. In chronic kidney disease, why they develop pedal edema? As we discussed the four factors, here in chronic kidney disease, the swelling is because the kidneys are not able to get rid of extra fluid or salt which has been retained in the blood. Or it can be because of protein loss in the urine, and then that protein decreases in the blood vessels and the fluid starts leaking. So this extra fluid can worsen problems which are already existing, like hypertension or even the heart failure. So as the chronic kidney disease worsens, the swelling of the legs, the ankle, or even the whole body can be swollen, which indicates that the kidney has failed or is failing to get rid of the extra fluid and salt. Now, coming to the diagnosis, how to diagnose the cause of pedal edema in a patient of chronic kidney disease. So for this, we need to take a detailed medical history, like whether he has got hypertension, diabetes, or he has got some diseases like SLE or rheumatoid arthritis, or the patient is taking painkillers for any orthopedic problem for a very long period, and by a thorough physical examination to look for What is the cause of the swelling? There are many reasons a patient can develop swelling, and kidney disease is one of them. So based on what type of swelling, whether it is pitting or whether there is tenderness, we can rule out whether it is a spidal edema secondary to a chronic kidney disease or it is other problem. We also need to do certain blood tests like serum creatinine and urine protein. So when this serum creatinine is increased, it says that the kidneys are not functioning well and they are getting damaged. And when we do urine protein, if normally there is no protein or very negligible protein in the urine, and we start finding more abnormally high level of protein in the urine, it means the kidneys are damaged. So this serum creatinine and urine protein are indicators of kidney function. So if they are increased, then the kidneys are being damaged. Okay. So we also need to do some special tests like thyroid function, cardiac evaluation, liver function test to rule out whether there are some other causes of bilateral pedal edema so that we can treat the patient better by diagnosing these coexisting diseases. Along with this, we also might require to do some scans in special conditions to rule out the cause for chronic kidney disease, like a sonography of the abdomen. So where we can come to know the size of the kidney. In chronic kidney disease, the size are small. If the kidney has got cysts, multiple cysts, or if there is thinning of the outer layer of the kidney. So these are all suggestive of a chronic kidney disease. We also need to do a renal Doppler to look for the blood flow to the kidneys. We might require to do a low dose CT scan, which will tell us about the presence of a renal calculi, or if there is any obstruction in the kidney tubes, we call it as ureters. In rarely, we also might require to do renal scans. These are nuclear scans, and these scans are useful in especially pediatric patients to know whether the exact details about the kidney structure and kidney function. So, having had a detailed medical history, and a detailed physical examination with this specific test, we can come to the diagnosis of exact cause for a chronic kidney disease. And by coming to a diagnosis of chronic kidney disease early, we can start the treatment early and halt the disease from progressing. We can also have a proper fluid management to avoid pedal edema, and overall we can improve the health of the patient. Now, coming to the management of pedal edema, how to manage pedal edema? So, after having diagnosed the cause for kidney disease, we have to treat the particular cause for that kidney disease and then manage the pedal edema. To manage pedal edema, we have got the use of medicines called as diuretics, so which push the extra fluid from the body into out of the body through urine. So along with this medications like diuretics, we also need to make some lifestyle changes, and we also need to have a regular health checkup. So the advantage of this regular health checkup is the the progression of the disease can be detected early so that the doctor can make any changes necessary in the treatment. So lastly, maintaining a healthy lifestyle with regular exercise, a balanced diet with low salt and potassium, and regular health checkups, managing CKD becomes very easy, or it is essential for managing CKD and reducing the complications coming out of CKD like pedal edema and other metabolic disorders. I hope with this little information I have conveyed, a little information to the general public regarding how significant is pedal edema, and it's has an indicator for a chronic kidney disease. Yeah, thank you.